Well, first and foremost, a very warm welcome to you all. Thank you so much for taking the time out of your busy and pressured days to spend the morning with us. It's a real delight to see so many people here this morning, and actually also to know that there is another 50 plus on the waiting list. So you're very favoured, because I think that really underlines the very keen interest that there is in early intervention. But can I introduce myself? My name is Christine Davies. I am your chair for the morning, and I have been fortunate enough to be a trustee of the Early Intervention Foundation since its inception. But just before I make a few opening remarks and I introduce Jo and Donna, can we just get a feel for who's in the room? And this is where I create personal and maximum offence to somebody. But so can you just raise your hand if you fit into any or a number of these categories? So, lead members, leaders, or local authority councillors. You're very welcome, and can I say thank you for allowing us to host this conference in the LGA. It's really very attractive, very attractive. Right, local authority managers and practitioners. Thank you. And representatives of children's charities. Very balanced. Government departments. Oh, right, very welcome. Academics and think tanks. Right. Parliamentarians, past and present. Graham, I think that's you. And Graham, can I say a particularly warm welcome? Because actually, if it wasn't for you, your idea, founding the Early Intervention Foundation, we wouldn't all be here today. So a particularly warm welcome. Right, representatives of health, the police, early intervention trustees, past and present, and staff. Okay, so who have I missed out and offended? Nobody. Well, that's a very, very broad and balanced representation. Thank you so much for that. Just quickly, a couple of housekeeping. I'm sure you found them already, but toilets are down there on the right. If there's a fire alarm, it's real, leave, go out of here, turn left, and onto the street. Can I say that personally, I am really proud to see the launch of this particular report, realising the potential for early intervention. I've been working in children's services for a very long time, 40 plus years, and have tried at all times to put effective early intervention at the heart of my work. And we're all here because we know that early intervention matters for children, for families, for communities, and the nation as a whole. But actually the context for delivering effective early intervention is a challenging one. And I won't rehearse all of the challenges, but just to mention that, the Institute of Government last week published a report which said, for example, that spend on children's social care on the part of local authorities since 2010 has risen by 14%, and yet spend on overall children's services, given the reduction to local authority funding, has decreased by 7% in real terms over the same period. And therefore, the reductions to services have had to be made in discretionary services, such as children's centres, youth services, and many others. And some of that targets on our ability to deliver early help and early intervention. So given the many challenges that confront children, young people, and services, this report is very timely because it does set out and take forward the debate on what we mean by effective early intervention and how together, both locally and nationally, we can take this debate and take these actions forward. So I think we're all here today because we welcome the conversation and hopefully welcome the recommendations contained in the report. So I'm going to now start the conference and first ask Jo Casebourne, who is the Chief Executive of the Early Intervention Foundation. Jo has been in post since August 2017 and was previously Director of Development for the Institute for Government, working on effective and public services. And then after Jo's introductory remarks, setting out the background for the report, Donna, who is EIF's Director for Policy and Practice, is going to take us through the headlines of the report that you've got in front of you. Now, I am sure that you will have comments, questions, areas for clarifications, even criticisms of some of the content of the report and headlines that Donna's going to set out. But if you can hold your questions, because after Jo and Donna, we're going to have a panel representing local government, public health, and charities and local government to give a response to the contents of the report. And then we'll open it up for 50 minutes, an hour of questions and answers to the panel and to EIF. So, Jo, can I ask you to come and give us the background to how this report started its life and where it's now ended up? Thank you.
Thanks very much indeed, Chris. I just want to talk to you very briefly this morning about why we felt that now was the right time to refresh the case for early intervention. As many of you will know, EIF is an independent charity founded in 2013 and one of the government's What Works centres. And this means that we provide objective advice and guidance to organisations working in the field of early intervention that's based on the evidence. And this year marks 5 years since we were first set up. So we've been looking back at what's been achieved in that period and looking forward to what is still needed to do to really realise the potential of early intervention. And of course, it's also 7 years now since Graham Allen's first government commissioned report on early intervention, and an awful lot has changed in that period. We've seen, of course, a succession of political changes in government and in leadership of all the main political parties, the still emerging implications and impacts of Brexit, and a political environment in which debates about policy priorities are often focused away from many of the traditional concerns of social policy, including children. And yet, during this period, we know that too many children are facing challenges and disadvantages that can affect their development and threaten their future life chances, health, and happiness. And we also know that the context for early intervention is really challenging for local government and their partners, with increasing financial pressures and increasing demand for services. But the good news is we know a lot now about how problems that are experienced in childhood impact on the long-term outcomes for children. We know a lot about where the best potential for early intervention lies, which children can best be helped, and which child outcomes can be improved by effective early intervention. So the evidence base is growing all the time, although major gaps still remain. So in light of all of these changes, this year we refreshed our strategy to ensure that we can make the most of the challenges ahead in the next 5 years. And you've got a copy of our strategy in your delegate pack today, alongside a copy of the report. And in the strategy, we set the direction of travel on how best we can work to achieve our mission, which is to ensure that effective early intervention is available and is used to improve the lives of children and young people who are at risk of poor outcomes. So to do that, we'll be continuing to generate evidence on what is effective early intervention and what is not. And we'll be expanding the type of evidence that we generate, from our guidebook of evidence-based programmes to looking at evidence on what is effective workforce practice and how to make local early help systems effective. We're also going to be putting much more emphasis on our work to get evidence used to change both policy and practice. And to do that, we'll be partnering with children's charities, workforce bodies and policymakers, and many of you in the room, I hope, to do that. And our strategy also sets out why it's never felt more urgent than it does now to restate the case for early intervention, which of course is what today is all about. The reality, sadly, is that we've still got a long way to go before effective early intervention is available to every child and family that needs it. We need to take stock and look again at why this is, and if we're serious about improving outcomes for children, what needs to happen to remove some of these barriers. And as Graham so powerfully proved, this is an issue behind which we can unite across political divides. And we really now need to do that again. We need national politicians, policymakers and funders to put early intervention centre stage and commit to testing it in a bold and meaningful way. The long-term success of the country depends on helping children to reach their full potential. And we hope today, and the report that we've launched today, provides some suggestions on how we can work together to achieve that. So thank you very much for coming.
Thank you, Jo. Right, Donna, you have the hard bit. Take us through the report.
Thank you, Chris. This report contains some messages that will be familiar to many of you here, but hopefully also a slightly new take on some things as well. Of course, the case for early intervention doesn't change dramatically from one year to the next, but it does evolve, and it has evolved in the 5 years since EIF have been going. And as Jo said, there is lots about the current context that we feel requires us to update this case and to start a debate about where we go next. The starting point is this: too many children in England currently face challenges or disadvantages that affect their development, threaten their future life chances, health and happiness. You all know this. We all see it frequently in the headlines about children in poverty, school exclusions, children's mental health, and so on. But these early problems which affect children's development are not fixed or set in stone, and they do not have to dictate future outcomes. Early intervention can offer these children and young people the support they need to reach their potential. And if there is one headline message in this report, it is this, which is that whilst early intervention cannot solve all problems, it can substantially improve children's lives if it is delivered to a high standard and directed to the children or families who need it the most. And despite the current immensely challenging context, we just must keep sight of this, because we know early intervention can improve outcomes for children, and we're not currently realising the potential of this agenda. We need to take stock of where we are, face up to some of the challenges, and develop new ambition and a way forward. It's important to start with what we mean by early intervention, because despite our best efforts over the last few years at EIF, this is still not a term that is consistently understood by many of our audiences. By early intervention, what we mean at EIF is identifying and providing effective early support to children and young people who are at risk of poor outcomes. We know that early intervention works best when available to children and families who are identified as facing particular risks, either because of certain demographic characteristics or because early signs of problems are identified. And this support is more intensive or additional to that which is typically available through universal services such as schools or GPs, although these services, of course, are vital, not least because they are often how those children and families who need support are identified. Early intervention can take many different forms. It includes a wide range of activities, from early home visiting, supporting children's language development, school-based programmes and family therapy to improve children's behaviour. This is broad territory. And a point that always needs reinforcing: it's not just about the early years. We know that problems can emerge throughout childhood and adolescence, and that effective early intervention can be relevant from conception right through to early adulthood. And finally, not everything that could be described as early intervention can be classed as effective, by which we mean having evidence of improving outcomes for children and young people. A small number of things have been robustly tested and shown not to deliver those child outcomes, but a much larger set of things have not yet been tested, and that's a point I will come back to. So how do we know which children can benefit from early intervention? Well, we now have a good understanding of the risk factors that can threaten children's development. As is very well known, these risk factors operate at different levels and relate to the child, the family, the community, and wider society. Just to say, the populated version of that diagram is on page 7 of the report if people are wondering what the circles represent. And this captures all of the risks that we know to be important. And understanding these risks matters because it means we can identify those children and young people who can benefit from early intervention. Some of these risks are pervasive. Poverty and economic stress, for example, can significantly affect parents' ability to provide the calm, consistent and nurturing environment that we know children need. And we know that wide and persistent gaps in children's development open up early along socioeconomic lines. So where can early intervention have the greatest impact? Being clear about this is really important, and it helps us focus our efforts on where most difference can be made. We now have a good sense from the evidence about where early intervention can play a significant role. Early intervention is likely to have the greatest impact when it's used to support the 4 key domains of child development and prevent 3 major threats to children's development. The 4 key areas of development on the slide here will be familiar to many of you. These are cognitive development. We know that speech and language skills, the ability to read and write, numeracy and problem-solving capabilities are highly associated with success in school and entry into the workforce. Behavioural development, children's ability to regulate their behaviour, attention and impulses is highly predictive of future involvement in criminal activity, both during teenage years and later in adulthood. Social and emotional development. We know that supporting children's social and emotional skills, by which we mean the knowledge and skills needed to manage emotions, show empathy, make responsible decisions, and achieve positive goals, are highly associated with children's ability to form positive relationships and associated with the reduced risk of depression and poor mental health. And finally, physical development. We know that children's physical well-being provides the basis for positive development across all other areas of children's lives. Early intervention can also target the key threats to child development, and the evidence highlights 3 areas: substance misuse or risky sexual behaviour, and being a victim of child maltreatment, which are all strongly associated with adverse outcomes during adolescence and in adulthood. There are early intervention approaches which have been shown to reduce these risks. And so, whilst the evidence isn't perfect, and inevitably there are still significant gaps, there are some things that we do know. We know that short-term improvements within these 7 areas, within those 4 areas of child development and 3 threats, within those 7 areas can lead to measurable benefits during childhood and beyond. And we know how to create these improvements. There are early intervention programs which target these 7 areas, which have good evidence of improving children's outcomes. The Early Intervention Foundation Guidebook, which hopefully many of you are familiar with, currently contains information on over 80 programs, 45 of which have been evaluated and shown by one robust study to improve outcomes for children. And we have more programs being added to the Guidebook very soon. And so we should be delivering more of these things that have been shown to work, because effective early intervention can offer these children and their families the support they need to fulfill their full potential. This is vital as a way of improving social mobility, reducing the impact of economic disadvantage and some of the other risks that we know can jeopardise children's futures. There is also a strong economic case for early intervention, but this requires a long-term focus. Some of the discussions about the economic benefits of early intervention can be overly focused on the potential for short-term cashable savings, which, whilst understandable given some of the current financial pressures, can sometimes be something of a distraction. Whilst cashable savings are possible in some specific circumstances, they are unlikely to arise in many cases for a fairly wide range of well-documented reasons, but simply because often reducing service use won't enable money to be taken out of the system. But we must not miss the bigger picture. The real benefit of early intervention is long-term benefits to society and the wider economy. This is good for the public sector. Leaving issues unresolved in childhood has far-reaching consequences for children's later life outcomes, leading to extra cost to services. We have estimated previously we spend 17 billion across public services in a single financial year on late intervention. Some of these costs could be avoided if effective early intervention was offered sooner to those children and young people who need it. This is good for the economy. To give one example, improving the educational attainment of disadvantaged children can have significant economic payoffs in terms of future earnings and employment. DFE have estimated that individuals who achieve 5 or more good GCSEs have lifetime productivity gains worth around £100,000 on average compared to those with qualifications below this level. And finally, this is good for communities, which are better off, more resilient and more supportive places for children and young people to grow up in. And whilst it's difficult to estimate the value of these benefits with precision or accuracy, there is a wide literature which shows that the benefits are considerable and likely to pay off in overall economic terms. And however calculated, in the final analysis, the value of these benefits are likely to be considerably higher than the initial cost of intervening. So, while the case for early intervention is strong, we have, however, a long way to go, as Jo said, before effective early intervention is available to every child or young person who needs it. While the potential of this agenda is clear, it is currently not being realised. Many local authorities and their partners in schools, the NHS and the police have been trying to prioritise early intervention for many years now. There have been some successes, but some challenges too. Part of the reason for this is that the current system is not designed in a way that fully enables early intervention, and fundamental changes are required. We have identified 5 barriers which get in the way of this agenda. These are not new. Many have been discussed and debated for some time now, but they need revisiting if we are to make progress on this agenda. The first is funding. Funding is an issue both in terms of the current resource in the system. I don't need to tell people in this room that current funding pressures can leave little space for early intervention, but also the way that funding is distributed and flows from national to local government. The siloed nature of funding continues to be a problem. The long-term benefits of early intervention are often unlikely to accrue to the agency who invests in the first place. Short-termism. We all know that electoral cycles and spending rounds can drive a focus on short-term actions rather than the long-term, but this matters. It means that too little attention is given to the scientific evidence about what matters for children's development, and too much emphasis on short-term initiatives or funding streams in response to some of the urgent issues of the day. These short-term funding streams are often unlikely to deliver sustainable improvements or be the best use of available resources. Fragmented responsibility. The fragmentation of policy responsibility for children across numerous Whitehall departments is a long-standing problem, and arguably, given the breadth of issues which impinge on children and families' lives, this is inevitable to some extent. Nonetheless, though, the current lack of an effective workaround around this is problematic. Not delivering what works. There can be a significant gap between what the evidence tells us is effective and what is actually being commissioned and delivered for children and families. This is not surprising in many ways. Commissioning evidence-based early intervention is not easy. It can be difficult to apply the evidence to fit with a specific local context. Programs which have performed well overseas don't always travel well and perform well here, and so on. But despite all of that, evidence matters and we must try and use it. Where we have good evidence of programs which have been shown to be effective in improving outcomes for children and young people, we should be using this evidence. Because when you put everything else aside, the fact is that on balance, children and families who receive interventions which have been shown by robust methods to improve outcomes for families are more likely to benefit, and to a greater degree, than those who don't. And finally, as I'm sure you would expect us to say, there are also gaps in the evidence in our understanding of what works. And currently there are too many areas of early intervention activity where actually the evidence can do very little to guide us. The strongest evidence for early intervention is from evaluations of early intervention programmes, which, whilst important, as many of you here frequently remind us, are only part of the picture in terms of developing an effective early intervention offer. We need to develop the evidence to answer wider questions about the most effective practices among the different workforces that make up the early intervention workforce collectively, and crucially, what works best in terms of local systems and factors such as culture, leadership, and partnership working that is needed to support effective early intervention. Our view is that if we're to make significant progress in developing the evidence base on these areas, then we must focus on increasing capacity and capability for evaluation locally. If we can build capacity and capability in local services to generate good quality evidence about what is being delivered, then over time we will start to deliver and create the step change in the quality and quantity of evidence relating to early intervention in the UK. Right now, we believe early intervention is as crucial as ever. It's as necessary as it ever was, and it's vital to some of the current societal concerns. Yet the way ahead for this agenda is not currently secure or mapped out. If we're going to realise the potential of early intervention to improve the lives of children and families across the country, we must come to terms with the scale of the challenge and the level of political priority and commitment that is required, both in terms of increasing the availability of effective services and developing the evidence. We need clear leadership and concerted effort at both national and local level. This cannot be done without resources, and there are no quick fixes here. But if we're serious about improving outcomes, particularly for some of the most vulnerable children, then we need to recognise that supporting children and families with complex problems requires a resource-intensive and long-term response. 4 actions at national government level would lay the foundation for significant progress. Firstly, a new long-term investment fund is needed to enable a small number of local areas to put in place effective early intervention across childhood and adolescence and test the impact of this. Much of the evidence for early intervention rests on evaluations of single programmes or single interventions. If this was accompanied by long-term impact evaluation, this would allow us to take a huge step forward in our understanding of what can be achieved by a comprehensive, place-based approach in terms of population-level outcomes. This is vital in taking the big step forward from understanding the theoretical potential of early intervention to building the actual empirical evidence of its impact when all of the necessary conditions are in place. Secondly, a What Works Acceleration Fund. Funding is needed to increase the availability of interventions that have been shown to be effective. This would enable local areas to access resources and support to put in place those interventions with good evidence that I've talked about and start to reduce the gaps we sometimes see between the evidence and what gets delivered. An independent expert panel should be convened to agree the scope of an ambitious long-term research strategy to develop the UK evidence base for early intervention and advise on how this should be funded, both from within and outside government. This should cover how to fill some of the most urgent gaps in evidence, such as how to build the evidence on these crucial areas such as practice and systems, and how to build capacity locally to generate high-quality evidence. And finally, to overcome some of the policy fragmentation, a cross-government task force on early intervention should be established, led by a senior cabinet-level minister. This should oversee the delivery of these commitments and drive coordinated use of resources across government. There are also actions that need to be taken at local level. Some of the strongest advocates for early intervention are to be found locally in children's services and the wider partnership. Some local leaders, and many of you are in the room today, have fought hard for this agenda in the face of significant financial and other challenges. Elected members and local service leaders can play a vital role in this agenda in two ways. Firstly, setting a compelling vision that mobilises the local partnership around the philosophy of early intervention. This should be realistic and not founded on the promise of short-term savings or immediate reductions in pressures on children's social care, but reflect the wider benefits of early intervention to communities and to the local economy. And secondly, local politicians and service leaders can ensure that evidence-based decision-making is an integral part of the vision and culture they create in their local area, and that evidence informs all reviews of expenditure. And so to finish, the case for early intervention is strong. We should be clear about what early intervention isn't. It isn't a panacea for all of society's problems, nor is it a financial coping strategy for central or local government. But it is a vital way of providing children with the skills they need to succeed in life, and crucially mitigating the negative impacts of poverty and other types of disadvantage. We believe the actions in this report will take this agenda to the next level and provide a route map. We've all been talking about the potential of early intervention for a long time now. We must act to move beyond the theory and to build strong empirical evidence of what can be achieved, or we'll still be having the same conversation years from now. This is an issue on which we can unite across the political spectrum, and the case for action, both nationally and locally, is strong. We would all agree, I think, that the success of the country depends on supporting all children to achieve their potential. If anything is worthy of long-term commitment and planning, surely it is this.
Donna, thank you. That was excellent. It was clear, concise and compelling, and I am absolutely certain that people will want to read the report as soon as they can. I think what was particularly interesting was your honesty that we need to develop a more nuanced economic case that early intervention is unlikely to generate short-term cashable savings, but without doubt will generate longer-term, both social and economic benefits. And you set out very clearly the 5 key barriers, but the 4 actions that you would like to see and advocating for both national government and 2 key actions for local government. But I think also the thing to hold on to is that we now know better that effective early intervention can change children's lives if it's delivered effectively and targeted well. And we know better about where it can have the greatest impact. So there's a lot in what you said and a great deal in the report. So really, thank you so much.